Hello, this is Dr. Matt. If I haven't met you guys already, it's been a pleasure to meet you. I'm glad you guys can make it here for this workshop tonight. It's your next step in the right direction of getting back your health. I know you guys have probably met Dr. Ron or Dr. Caitlin, as they've explained a lot in what we're going to go over tonight. I want to make sure you get the most out of your care. I want to make sure you protect your time, energy, and the investment that you made in your health at our office. I'd like to start by thanking all of you for being here. I can always tell who is serious about improving their health and who views their health as a priority, because those that are the people who make sure to attend this workshop in office when we have it every other Tuesday, or by listening to this workshop and filling out the worksheet as well. So you can make sure that you have the most information about how to get the most out of your care and improve your health as quickly as possible. So I want to applaud you for taking this action step towards improve your health. In the next 20 to 30 minutes, you're going to discover the most effective way, the most powerful way, and the most natural way to be healthy. Now, once you discover the information that I'm going to share with you tonight, um, can do for you and get you more energy, reduce sickness, be pain-free, and can drastically reduce your chance of needing surgery or being impacted by diseases like cancer, heart disease, or diabetes, the diseases that are robbing people, your friends and family, of life, and leading to an early death in 5 out of 6 Americans today. Instead, you can once and for all maximize your health potential and not have to worry about those other things. Now, you've made a commitment by being here today, and I appreciate that, but I want you to get the most out of this time as possible. So I'm going to ask another commitment from you. That is that you are really here, truly present, and you listen, and most of all, think. I'm not going to ask you to think like me, but I'm going to ask you to think. Now, can you commit to that? I hope so. So the most important thing you're going to learn today is your spine and your nervous system are the foundation of health and life in the body. Now, this isn't the first time you've probably heard that, hopefully, because I know you've heard it numerous times on your day one and day two process. So, a quiz to start off. Do we live in a healthy or sick country? Are Americans really healthy? Now, when we get to this, we got to look at some statistics, first of all. But what do you guys think? Do you think we live in a healthy or sick country? A lot of times people are going to say, no, we don't. We're not in a healthy country. We are very sick. And it doesn't take an educated person to realize this. Which country spends the most on healthcare, right? I mean, when we look at the stats, in a study in 2008, 130 million people were suffering from chronic diseases. Now, that's cancer, heart disease, diabetes. We were spending $2 trillion a year on our just chronic illness alone. The reason why I posted the study in 2008, they projected in 2022 we'd be spending $5 trillion a year. Now, they didn't plan for the pandemics and all that stuff, but we are well above that mark today. Which country takes the most medicine? The United States, of course, right? So we're taking 45% of the world's drugs, but we are less than 5% of the world's population. Now, third and final question. When the world's top 40 developed countries are rated according to healthiest nation, where does the U.S. land on that list? What do you think? One being the healthiest, 40 being the sickest, with all that funding, all those resources, all the research, the technology, the testing, the treatment, the drugs, and the surgeries, where do we fall on the list of healthiest nations? First, 10th. Would you be disappointed with 20th? Mad at 30th? We are 37th. Now, that's pretty incredible if you think about it. We got all these things. We're doing the most, we're taking the most, we're spending the most, and we're 37th out of 40. It's pretty pathetic if you ask me. We are number one in crisis care, but we are number 37th in healthcare, which is pretty bad. Now, I put this up here, and I understand not everybody's falls under the Medicare. Myself being 37, I don't have Medicare, but if I read this for you, a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life or therapy that is performed to maintain and prevent deterioration of a chronic condition is deemed not medically necessary. So the reason why I put this here is because it is saying that if you're trying to do anything to help your life, that's not in a crisis standpoint, but just promote health, live a better quality of life, and you want to use your insurance for it, you cannot do that. So why do I put this up here? Because a lot of most insurance companies are leading towards the Medicare guidelines. Medicare is setting the ground rule for a lot of this stuff. So when I put it up here, I'm saying no one is coming to save you. No one's going to help you. The insurance world is not there to be your health partner. They are to get you out of a crisis and stop. It's like car insurance, right? So car insurance to get you out of the accident. They're not there to change your oil, change your tires, put gas in your car. They don't care about keeping you on that healthy track. They just want to get you out of a crisis. So why, again, I go back to it. This is there to say that, hey, you have to start looking at your health. Just because we have all these fancy things in this country, that doesn't mean it's going to keep you healthy. You are truly the only person that can do that for yourself. Now, it's great that we have all this fancy stuff and technology and research and the ability and access, but that doesn't mean you have to solely rely upon it. Think of if you're using your insurance, that's not a good thing because that means you're not staying healthy. Now, you're probably thinking, well, I get these annual checkups. What is that annual checkup really looking at? Very surface level things to checkbox, to mark off some things on the form. But how in depth do your actual doctors go over this stuff? Not not much. And that's what we hear all the time is how we're so much unique and different than everybody else because we do take the time. We are very, very thorough in your health. We go beyond the spine and nervous system and we're looking at the organs, the glands, the blood vessels, how it affects your overall quality of life. So when we bring all this up, the current model is failing, right? There's more cancer, more heart disease, more diabetes, more strokes, and more obesity, allergies, asthma. I mean, we can go on and on and on about this, but all of these things are continue to increase each year. Now, if you have a child, 1 in 54 children have autism. If you have a boy, that's a 600% increase in the past 20 years. 5 out of 6 people die from cancer and heart disease. 65% of all bankruptcies are from a health crisis. 75% of those had insurances. Americans take about 25 million pills an hour. 4.5 million people have Alzheimer's. That's doubled in the past 2 decades. 118 million antidepressants prescribed for 57 million Americans. 25% of the children in the United States are taking meds for a chronic disorder. That's something we think, right? Oh, it's something we get older, it's chronic. No, that's something that it's been usually there for a long time. So if kids, what they're factoring under the age of 18, are already dealing with chronic issues that shouldn't be happening. There's 74 million kids in the United States right now. 45 million kids on asthma medications, 24 million on ADHD medications, 9 million on antidepressants, 6.5 million kids on antipsychotics, 5 million on high blood pressure medications, 300,000 on sleeping pills. And you can see this is just getting worse, you guys. So non-insulin diabetic medication used to be called adult onset, but we can't call that anymore. And statins, 94,000. So you can see we're not trending in the right direction. 2009, the Centers for Disease Control, the CDC, put out the statement said, for the first time in history of man, children born after the year 2000 are not expected to live as long as their parents. So, me being a father of two, 2 kids under 2, this really hits home for me because, all these things that, they're telling me of how I should raise my kids and what I should give them and do and all this stuff. They're also saying they're not going to live as long as me. So how does that make you feel as a parent, an aunt, an uncle, a neighbor, anybody, a friend, right? Do not let other people, right, just not understand how important it is to take care of your health. The next question I have for you is, are you as healthy as you want to be, right? How about your family, your children? As a doctor, in my experience, the answer is overwhelmingly no. And from what I've seen, there are three reasons that we're in a health crisis. Number one, personal responsibility. Now, who's in charge of your health? Your spouse, your doctor, the system, your insurance company. Ultimately, who is responsible for your health? You are. Second is we have the wrong definition of health. I am healthy if what? I look good, I feel good, so I must be healthy, I must be free of disease. So tell me, what does cancer feel like? What does heart disease feel like? What does diabetes feel like? Let me ask you, by the time you feel any of these, are you in trouble or are you in trouble? So you may be wondering what the definition of health is. Health is optimal physical and social and mental well-being, not merely the absence of disease or infirmity. So health is not about how you feel, health is about how you function. So if you want to be healthy, you have to be functionally optimally. And what is the third reason we're in a health crisis? Does anyone know the third reason? I'll tell you that later at the end. I'll come back to it. So please don't let me forget it here. So here's what I know, and finish the state with me. If you keep doing what you've been doing, then you're getting what you've always got, right? If you are like most patients that I meet, that you are not satisfied with the results you've been getting, you do not want to keep doing what you've been doing. You are ready for a different approach, a better way. So let me share with you what I've learned over the past 6 years in 5,000 patients. I call it 10 questions you must ask yourself if you want to be healthy. Are you designed to be healthy or sick? Right? Healthy. Healthy is normal. Unhealthy is abnormal. Our body's default is to be healthy. 3,000 plus generations came before us to prove it. 99.6% of people possess the genes to express perfect health at all times. Healthy is normal, but unhealthy is the norm that we've created. So when I put up this chart, we're all at letter A right now. So we're all right here. And at birth, we're up here. And for somehow, whether this was a week, 1 month, 1 year, 10 years, 20 years, 50 years, now we're at letter A. Our job, and I say our job being, here at the office, and your job is to get you back to where you were at wellness care. So that is our goal. But let's start talking about how we're going to get there. Is your body smart or stupid? Your body is smart. Your body is brilliant. At the moment of conception, you received all the genetic information necessary for you to function and regenerate. After conception, 270 days later, you have a full human being. The baby's body innately knows what's supposed to develop, when and how it's supposed to develop. There is an innate intelligence that runs through your body. This innate intelligence works with your nervous system to keep you healthy and heal your body. Since your body innately knows how to heal itself, that shows us that health comes from the inside out, not the outside in. Let's look at a couple ways your innate intelligence and your body works to keep us healthy. Fever. Why do you get a fever? To kill the virus and bacteria because your body knows. Is that smart or stupid? That's intelligence. Eat bad food, seafood, you're vomiting, smart or stupid. Again, these are all smart things. We wouldn't purposely eat bad seafood, but your body knew that, so it's incredibly smart. What is the most important system in your body for staying healthy? Is it your immune system, your cardiovascular, your lymph system, your endocrine system, right? The nerve system is the master system. The innate intelligence that travels across this nervous system. This nervous system is the communication system for the body. It is the system that helps us adapt to and deal with stress. The flow of that intelligence or information across the nerves is what keeps us healthy and healing. All tissues, organs, and organ systems rely on the nerve system to supply the function well and stay healthy. So let's start at the start. Your brain is the constant communication with all your tissues, organs, and organ systems. All of these systems are always talking back to the brain. All of that communication takes place across the nerves. It's that exchange of information that keeps your body functioning properly and how all healing happens. That's what keeps you upright and how your body digests your lunch, how your body knows how to build healthy cells, and where the nutrients need to go. It has kept you alive your entire life. It is healing you as you sit here. It will heal you as you sleep tonight, and it will wake you up in the morning. All of this across your nervous system is happening right now. So are we starting to see now how your spine and nervous system are the foundation of health and life in the body? It's incredibly important that we remember that statement. What protects your nervous system? Your spine, right? Your spine is your suit of armor. Your spine is your lifeline. Your spine protects your nerve system like your skull protects your brain. Your skull is your helmet, right? That protects your brain, and your spine is your suit of armor that protects your spinal cord. If you want to be healthy, you must have a healthy nervous system. If you want to have a healthy nervous system, you have to have a healthy spine. Question number 5. Is your life stressful? Life is more stressful every year. Raise your hand if you think stress can be a negative on your body. Of course, right? So if we can help you deal with the stress better and reduce your overall stress, don't you think that'd be a good thing for your body? So let's look at the 3 types of stress that can cause problems, right? There's mental stress, there's social, psychological, mental, or emotional. A lot of people, when I say the word, even stress, our mind jumps to this type of stress. Because if I ask you, hey, are you feeling stressed today? We ultimately think it's mental stress. But there's chemical stress involved too, right? Diet, drugs, pollution, the stuff. So it's what you're putting into your body. And then there's that physical stress. So that's the macro, the big ones, right? The car accidents, slips and falls, sports injuries, accidents, even birth trauma. And then there's the micro, the bad habits, right? Our lifestyles, our rituals, the stuff that we really need to look at tonight is looking at, okay, what are those things that I'm doing on a regular basis every day, those everyday things that are it's so monotonous, so monotony, whatever word you want to put behind it, but it's the stuff we're doing every day that is actually getting us into trouble. So when we look at this, right, raise your hand or think about it, or in the own comforts of your living there, right? Are you married? Do you have a friendship? Do you raise a family? Do you work? Do you pay bills? Do you drive traffic? Do you care about food prices, gas pump prices? Right there, those are 6 everyday things that we may experience, right? So of emotional stress. Now, same thing with chemical stress. Do we go outside? Do we go inside? Drink water, showering. Largest organ of your body is your skin. So what you put on your skin is going into your body. So we need to look at shampoos and deodorants and all this different type of stuff. Now, am I saying that showering is creating subluxations? If you're dealing with skin issues, maybe it is. So we need to look at that stuff. If your body's being worn down by a toxic load of heavy metals in your deodorant, you may need to look at that stuff. Do you use alcohol, tobacco, take over the counter drugs or prescription drugs? All these things are chemical stress. And of course, like I just mentioned, physical stress, auto accidents, athletic injuries and activities, exercising bad form, repetitive lifting or motion, yard work, sitting in a forward flex position for 20 minutes or longer, like a desk job, right? We know sitting is the new smoking. Our lifestyle stress, our toxic, deficient lifestyle choices, bad habits cause and promote subluxation patterns and problems with your spine. What do we know to our spine all day, right? What are we doing to it all day? First, laying in bed in the morning, probably laying on your stomach so you turn your head so you can breathe. That turning pulls that curve out of your spine. Or you lay on your back and you push it up with pillows. Then you sit up, go downstairs, read over the breakfast, brush your teeth, go to the car, drive to work, sit at the computer all day, bang your head against the computer all day, and back in the car, sit on the couch, watch the TV, or sit at the computer. And we wonder why everyone's having such a hard time. It looks nothing like the spine is supposed to be looking like. So what is all this stress doing to your body, right? Stress causes problems in the spine, a condition known as subluxation. So when a joint gets out of a healthy alignment by trauma or bad habits that cause damage to the soft tissues, inflammation, swelling, and the inflammation causes nerve irritation. This nerve irritation is called subluxation. Subluxations cause a breakdown in the communication in the nervous system. This causes more inflammation, irritation, and more stress, which causes a downward spiral. This also leads to muscle spasms and joint fixations, because is your body smart or stupid? Smart. So when is your body unstable, it causes muscle spasms to splint that joint to keep you from doing further damage. So with subluxation, you end up with stress hormone production. If you irritate a nerve, it creates a stress response in your body. So when we look at this, right, these are the phases of degeneration. We went over, what phase you're in, 1, 2, 3, hopefully not 4, but a lot of times maybe there's between 1 and 2, between 2 and 3, on the way almost to 2. And I put this up here to say, like, hey, this is how long it took you to get here. Now, that doesn't mean it's going to take you that long to get out, but just understand it didn't happen overnight. It's not going to go away overnight. So your body's been patient with you for a very long time, whether you realize it or not, whether you are okay with it or not. That's just where we're at right now. So you have to be patient on this healing process for your body to catch back up with you. Right now, we're at better, right? We're in that initial intensive care spot. Now, our goal is to obviously, remember, like I said, get you back to that wellness care where you were first born at. Now, that may take some time, and I only put 3 years on here. This could be, 2 years, 3 years, 10 years, 20 years. I don't know. It's really all dependent on you guys, right? Of course, we can help you guys get to that point, but what you're doing outside of our office is the biggest key. So what do we think all this, what the real cause of these health problems are, right? So when we're looking, the information flowing across your nerves is what keeps the organs working properly, like wires in a home. Nerves go to specific organs that have specific functions. Any nerve interference creates dysfunction in that organ. In other words, the organ does not work right. The subluxation, and the subluxation is very often, is causing disease and can rob you from health and life. Subluxations typically start silently and then eventually show signs of symptoms. As you may have guessed already, subluxations can be the root cause of back pain, neck pain, or headaches. But what you probably do not know is that subluxation can cause digestive problems like reflux and heartburn, food intolerances, constipation, blood pressure issues, breathing conditions like asthma, or immune system disorders like allergies, eczema, or other skin issues. Subluxations can often present as stiffness or soreness in the joints and muscles, but even more commonly, they can present as energy issues, sleep problems, or anxiety. Think about it. Who do you know that suffers from any of these? So your body's trying to tell you something, right? Instead of thinking about symptoms, think of your as signals. Your body is signaling to you something. So treating symptoms is like taking the batteries out of the smoke detector when it goes off in the middle of the night. Probably better for your safety or the safety of your family to find the cause first and address that. Question number 8. What is your nervous, or how is your nervous system functioning? How do we know it is? How do you know if you have a subluxation? How about another question? How do you know if you have a high cholesterol? How does high cholesterol feel like? You have to get it checked, right? What about high blood sugar? What does that feel like? We don't know. We have to have it checked, right? Same thing with subluxation. How do you know if you have subluxation? You have to get it checked. You shouldn't wait until pain or symptoms develop to know whether you or not you have subluxation. Only us chiropractors are trained to correct subluxations. There are unique tests that we are trained in to identify subluxations. There are specific tests that can be done to detect early signs of subluxation. That's why it's really important for everyone to have their spine checked. Question 9. What should you do to correct problems with your nervous system? Us chiropractors have a unique expertise. We are specialists in finding and correcting subluxations. We specialize in correcting these issues so that the spine can heal and stay healthy, and the nervous system, the master system, can work properly as a result to heal the body. So that, right, you guys can get rid of your pain, correct your health issues, and get back to doing the things that you want to do without the dangerous drugs or surgery. Everyone has a spine, and everyone is susceptible. Everyone should be checked. That is why we see a lot of kids in our office. The sooner you get checked, the better, right? When's the best time to get checked? Now, right? So on the sheet that I gave you guys, I want you to just focus on this first question being, where do you want your health to be like in the next 20 to 30 years? Now, the next three questions are just to help promote more thoughts into that question. But you look at, right, the recent stats come out that the average male will typically uh, die around the age of 74. Women are a little bit longer. But if we're just going off of that, and the average retirement age is 64, right? That's giving you 10 years to really enjoy your health, your retirement, all that thing. So let's start focusing on increasing that gap, So let's focus on 20 to 30 years. And maybe you're sitting there and you're thinking, well, geez, I don't know if I have tomorrow, or I'm already 90, 20 to 30 years would put me in the hundreds. Great, whatever number that is for you guys, or maybe you're a teenager, you're sitting here, well, I don't know what I'm going to do when I'm 40. Whatever it is, right, you guys? But let's start thinking way far down the line. Where do you want your health to be like in the next 20 to 30 years? The other question I asked is, what do you want to feel like, right? That doesn't mean no pain. I don't want to see that, don't want to hear it. Do you want to feel more confident? Do you want to feel uh, like you're resilient, that you can resistant to anything that comes across? You want to feel confident that you can go into Thanksgiving family or hold a baby and someone to sneeze in your face and not immediately get sick, right? I know all gross things there, but I'm just making large examples there. What are your activities do you feel like? Do you want your activity levels to be that you want to run a marathon, that you want to climb a mountain, all of those things, right? Let's start thinking of those activity levels. Then what's the most important aspect in your life in 20 to 30 years? Is it family? Is it your health? What is it? Because I can just tell you, there's nothing more important than your health. All things are important, but if you don't have your health, you're not going to have anything else going for you. So you have to take action, right? So we're going to do that for you. We teach our patients exactly what they need to do to get their health back and stay healthy. We teach the three-legged stool to get the best results. The key to getting better results faster is realizing that we cannot do this for you. We are going to do this with you. This is a partnership. And in order to get the best results, you are going to have to get engaged and follow three simple rules, right? It's adjustments of rhythm. Making your adjustments as scheduled every week is the most important thing you can do. You start changing your appointments around, not getting those adjustments of rhythm, you're going to be back to where you were. Nobody wants that. You get frustrated because you're not getting those fast results. We get frustrated because you're frustrated. Nobody's happy. Break those bad habits. Now, I can sit here to tell you to stop all this stuff, and it may seem very daunting. So start easy, right? If a bad habit is yours is not drinking water, well, start drinking water. If it's eating too much, well, stop eating so much. If it's eating too much sugar, if you guys get it, right? So we all have these habits. If it's, I would start with the easy ones and go from there. If you're having trouble with your discovering what a bad habit is, let us know. We can probably help you out with two or three of them. And then we're going to give you some stretches and exercises along the way to help you out, hold your adjustments longer, and get to that point that you want. So I want to look at the phases of care, right? When we look at the phases of care that you're going to be going through, it's the first that is right now, the initial intensive process, right? Then we get to the corrective care, which is the strengthening phase, and then we'll get to the wellness phase. The initial intensive care, right, is get your body out of a crisis, reconnect the brain to the organs, restore function back to 100%. Get your body out of that crisis. What's the crisis? The brain is not connecting to the body. The crisis is your organs aren't getting the energy right now. Why? There's no curve in your neck. So our goal is to start putting curves in your spine, or you don't have a curve in your lower back. Let's get that curve back. We have to start doing that stuff, intensively, right? You've not taken care of your health intensively. Now we have to take care of it the other way, right? So let's, we're gonna get
ahead of the problem so your body can start to heal and function more properly. Now, when we look at corrective care is once function is restored, reduce the frequency to 2 times a week, right? So we're looking at Mondays and Thursdays because initially intensive care, you can't even hold your adjustments or maintain that energy flow for 24 hours. Not until we get that curve back in your neck or your back or your lower back. So once you can maintain your adjustments and the energy can get into your body for at least 24 hours, then we're going to get to that, the Monday and Thursday, right? So when we're 24 hours, that's one day. You're doing that very well in initial intensive care. We want to see you holding your adjustments, like I said, 3 to 4 days in this corrective care model. Research on muscle ligament physiology shows it takes 12 to 18 months for the muscles to become more functional, ligaments to become more functional. So once you're through the corrective care process, we're going to get in that wellness care follow. And that's where real life's beginning. You're coming in once a week to improve on that optimal health. You're still doing the stretches and exercises every day. So then we look at what phase of care does real life begin at, right? Was it the initial intensive care phase? Was it the corrective care phase? Or was it the wellness phase, right? It's wellness. I know you guys are thinking, well, I'm taking care of the problem. I started the process. Yeah, but your body's in a crisis. We're still in dysfunction, disease. Your body still has no idea what's going on, right? Then we get to that strengthening where your body's still relying on more adjustments. Then we're getting that wellness care where it's only needing that one adjustment to nudge it in the right direction so you continue on that path for health. Number 10, when is the best time to deal with your health? We look at, our own worst enemies. Sometimes we can be our own worst enemies, but we put our problems off, cover things up. But when it happens, when we do that, the problem builds up and continues to get worse. And this leads to the third reason why we're in a health crisis. The 5 most dangerous words in healthcare are maybe it'll go away. How many people have tried to ignore their way out of a problem in the past? Issues only become more complex and more difficult and expensive to solve. Procrastination, you guys. So you guys have, probably didn't know much about your health up into this point. You guys didn't know how your body worked, how your nervous system worked, how even it was all related. We knew we had a spine, but we knew we had a nervous system, but it was just called the brain, and we didn't know how it did it, but it just did it, right? Now, no one's told you about that. That's fine, right? Let's not beat ourselves up about that. Why no one told you about any of this stuff until now. But what the important thing is, now you know, right? You have this information to arm yourself to make the best decisions for you and your family going forward. I want you to do something for me. I want you to go out and tell your friends how important your health is and what you should do to start with it, right? We're all going to help you guys out with that process, right? We're going to send you a welcome letter with a coffee card from Big on us. And then we're going to send you 2 VIP certificates. Those are good for your extended family and friends, coworkers, anybody like that. We've already given you a free entire family health checkup in that book we gave you on day 2. Sorry, guys. But if you guys didn't get those, please let us know at the counter, and we can definitely get you guys more of those. But we understand that people are going through life all different times, different paces, different speeds, and we understand that sometimes the exam can be the biggest hurdle for people because they just don't know what they don't know. Um, the exam alone can cost anywhere up to $200-300, depending on what's going on with you, and we're giving them at no cost. So I hope you guys learned today, right, that the most important thing is, right, your spine and your nervous system are the foundation of health and life in the body. That is it, you guys. If you guys have any questions, please don't hesitate to let us know in the office. We're happy to help you. Find us on the website. We have a ton of information on the website. Follow us on Facebook, Instagram, YouTube. We're on TikTok now. We're throwing you motivation, inspiration, health tidbits, celebrating the community. And that's what we're truly all about here at Full Potential Chiropractic is community and family. We want to make sure that you guys are very comfortable with us and that we're much more than just a chiropractic office. We're a beacon of light in this community for the optimal health and empowered living and how we should be living on a daily basis. So I hope you guys are encouraged to go out and tell others to be healthy, inspire them, get on the right track because we're here with you guys and we want to make sure you guys are all living at your most full potential. Have a great day, everybody.